What are the main factors that lead to heart disease and stroke?
Well, we've talked about those all along.
Mm-hmm.
You've got a genetic factor.
Yes.
Clearly, if everybody in your family dies of their heart attack at age 50,
Mm-hmm.
which incidentally was much more common 50 years ago than now, because now when you get your heart attack, you get it treated,
Mm-hmm.
and they're wonderful statistics about how much we've extended
Yeah.
life after the first heart attack,
Mm-hmm.
because there are many things we do now.
Mm-hmm.
But obviously, genetic is a factor.
Mm-hmm.
We look at the causes in terms of smoking becomes a very real factor in vascular disease.
Yeah.
And we did not realize how important a factor that was until the last 30 or 40 years.
Well, I was reading smoking along with taking like birth control and other things such as that can also increase your likelihood of heart disease.
That is correct. Certainly there are the instance of vascular disease in young women taking birth control. There are more. I'm not saying that that's a dangerous thing to do, because for the vast majority, it's a perfectly safe way of birth control. But if you are in that abnormal group, and your birth control, that can certainly increase the incidence of migraine and of vascular disease. And that is a small percentage of those taking birth control, but that is a risk factor. You're correct about that. But they're as we talked about, all of these things meld into it.
Yeah.
Hypertension, obesity, lack of exercise.
Yeah.
These things are all there. Cholesterol levels, they're all there.
What are ways to prevent heart disease and stroke?
Well, I think the first preventative that we look at, of course, is choose your right ancestors. It's a little bit hard to do.
We can't all do that.
We can't choose our ancestors. So you choose the right ancestors. You never take up smoking.
Yeah.
I cannot emphasize how important that is in the etiology of vascular disease and the heart disease that we're talking about, coronary artery disease and stroke. You certainly make sure your blood pressure is controlled. I think we've learned over the years that maintaining good cholesterol levels is important.
Yeah.
And of course, if you go to the doctor and you get your cholesterol checked, you not only have a total cholesterol, you have a low density lipoprotein cholesterol,
Yeah.
you have a high density lipoprotein cholesterol, and you have triglycerides as the components of your lipid profile. And all of those are important. Of all of those, probably the most important is having the low LDL. And in the asymptomatic individual, the guidelines are to try to get your LDL below 130. If you already have diagnosed heart disease, the guidelines that we push for are to get it below 100. And usually the lower the better. Most individuals can lower their LDL cholesterol from 200 to 160 with diet, diet alone. But usually to get it below 130 and below 100, it does require our medications.
Yeah.
And fortunately, we have a whole array of medications now that can do this, many of which now are quite inexpensive. None of these, all these came into the marketplace in the 80s. They didn't exist 50 years ago.
Yeah.
So that's just an example of how far we've come along in looking at heart disease in terms of its treatment and prevention.
Do you ever try to convince individuals to change their bad habits that could potentially lead to heart disease or stroke?
Do we ever try? Of course, this is one of the primary roles of a physician is trying to look at an individual, see what their habits are, both psychological and physical and whatever, and try to convince them to change. But again, that is an extraordinarily difficult task. To counsel a overweight person on how to lose weight, the success rate on doing that is extraordinarily low.
Yeah.
To counsel an individual to stop smoking, the success rate is low, which is why we're told to repeatedly. My best success in getting people to stop smoking is when I announce to them, you have cancer of the lung. Oh, I'll stop smoking. Well, at that point in time, it's too late. Or this is a heart attack. I'll stop smoking. But it's interesting to me that how oftentimes, even with the heart attack or the cancer, the individual is so addicted that they cannot do so. But fortunately, we have a lot of helps with those too. We've got specifically trained counselors. We've got several ranges of medication that help reduce the craving for cigarettes. But it still is the individual has to decide they're going to do that.
Yeah.
It's like the individual deciding to do whatever else, how hard it is. If you're going to come off illicit drugs, that's that's a very difficult task. Many people don't do it the first time. They stop several times before they're successful. The same thing with stopping smoking. Usually, if you question a successful individual who had their last cigarette 10 years ago, they will tell you in the period of time before they stopped smoking, they went through several stop smoking attempts, successful for 1 month, 2 months, 3 months. Often their success interrupted by an added stress in the family or a job that picked up that cigarette, and you go off to the races again. But the answer to your question is, do I try to counsel people to change their behaviors? Absolutely yes. I'm absolutely unsuccessful much of the time.
Yeah.
But that doesn't obligate me to stop trying. Obviously, I'm retired now, so I try not to advise people too much. But anyway, when I sometimes I can't keep my mouth shut. I do the advice anyway.
Yeah. Next question was, is it hard to get them to change their habits? But you did answer that.
You know, changing any habit is difficult.
Yeah, obviously.
Well, I mean, you're already aware of that, you know, in your own way. You change how anything, you name it.
Yeah.
Can you change? Well, you can if you work on it every day, every day,
Change
all at
is
once.
hard.
Every
We've
day.
noticed that with our country.
Do you comb your hair on the right or the left?
Yeah.
Well, it takes a while, you know, but you can do it.
Yeah.
Sometimes changing where you part your hair is a little bit easier than changing your smoking habit.
Yeah, I agree. What is your advice for improving one's health in order to reduce risk of heart disease and stroke?
Well, that's the easy one. Of course, I think one has to establish early in life the commitment to no smoke. You have to early in life establish the notion of having regular exercise. You have to early in life establish the habits of eating properly. And those are that has to be the big three. You know, and then the other things that you do, you know, regular checkups for your hypertension, your cholesterol values, you add that to the pot. As you get older, of course, having your carotids checked, these things are all in there. But the major baseline things are smoking, body habitus in terms of your weight situation, and exercise. Those are the things within everybody's power that they can do early on. And one would hope that we can encourage people to do that early on. You can't change your ancestors. You can change the effect that your ancestors' genes may have on you, developing the things that kill them at age 45 or 65.